Hi, I'm Dr. Kimberly Turner, and welcome to Moms, Minds, and Medicine Inside Maternal Health Research. This podcast is your trusted companion on the pregnancy journey, where we break down the latest insights, answer the real questions, and empower you to make informed decisions every step of the way. Hello, I'm Dr. Kimberly Turner, and welcome to the inaugural podcast, Moms, Minds, and Medicine Inside Maternal Health. We are so excited to bring this podcast to you. And as our inaugural event, we wanted to welcome Dr. Yvonne Bronner, who is the head of the Maternal Health Research Collaborative. Did I get all the words right?
You got them all right.
Yay! Yay. Dr. Bronner, can you just tell us a little bit about the collaborative and what its purpose is?
Well, the collaborative is a very interesting project in the sense that we are 16 universities located around the United States. And our purpose is to help women and their families be more successful, healthier. And what I say is healthier communities because they live in communities. And the collaborative is designed because we discovered a while ago that we did not have maternal and child health at many of our institutions that were located right in the places where the maternal mortality, morbidity needs were greatest. And our students came from those areas, and our students wanted to go back and practice in those areas. And so our collaborative was born out of that idea. And when you look at where we're located right where those areas, our need is greatest.
Right. It's so important because most of us know that there's a problem in the United States with women here dying and having terrible pregnancy outcomes at a much higher rate than other places in the world. So thank you for that work. And I also know that you are the coordinating center's spokesperson and leader. So how does that look different than the collaborative?
Okay. So the collaborative, if you think about that, there's 16 universities.
Right.
And so therefore, we need a lot of help bringing them together. And I like to use the construct of the family. So when we meet, we say that we are a family of 16 universities. But families have to have coordination and leadership if they're to stay focused, right?
Yes,
And
ma'am.
so the coordinating center sees its role as helping us all work together so that we stay focused on our main mission and that we are taking advantage of the opportunities for growth and development that we have. And in fact, our whole mission here at the center is technical assistance to the collaborative. So in other words, they have the goal to work locally. We have the goal to bring them together so that they work in unit.
I love it. So tell us a little bit about what brought you to this point in your career. I happen to know, I've known you a long time, that you started out in nutrition and maybe even a little something else before that.
Yep, home economics.
Really?
That is not something you hear much about nowadays, right?
I took it. We had that class.
Well, that's a good thing because home science is very important. And the first thing we learned there was the only business that most people will ever have is their home.
Wow.
And so therefore you want to organize it, you want to have it successful, you set goals and objectives just like you would in a real business. In fact, it is a real business.
Oh my gosh, yes. Yes.
And then nutrition, public health, and maternal and child health followed that.
Okay.
And so with that kind of mixture of things, I really have sort of a base of understanding of people, of communities, and a love for families.
Yes. The family is so important. We all know if the mother's not happy, the
Nobody's
community's not happy. And I also have a memory of opening a magazine one day and seeing your beautiful face with, I think, two other women talking about receiving this grant to study maternal health. Tell us what that was about.
Okay. So it goes back a bit because, as you recall, we discovered when we got to Morgan in 1999 that what was my first love, maternal and child health, did not exist in some of our institutions. And so what we wanted was this to happen here. And so what we were able to do is to meet with a group of about 10 universities who are HBCUs, historically Black universities.
Okay.
And we met for a year or so, and then we decided that we know what we want, we know why we want it. Remember, we are located in the same places. Our students
Yes.
come from there. They want to go back and practice there. Let's see what we can do. And so we tried to move this agenda forward. And guess what? We were successful. And so now we are funded to have these 16 universities, and the 16 universities with a coordinating center. And a big part of the dream that we had back in those, 3 or 4 years ago, we now have the opportunity to implement.
That's excellent. Just imagine what kind of impact you're going to have, not only here in Maryland,
Uh-huh.
where Morgan State is located, but all over this country.
Hmm.
And it's so interesting that I, a clinician, an OBGYN clinician of 30 years, am a part of this
Hmm.
project now because we're trying to figure out how to bring the public health sector and the medical communities together. So, what does that look like to you?
Hmm. Very important that we not go out and try to work with our communities just looking at the public health side. But
Right.
one of the things I said to our group is that we really want to know about the body. And most of us know a little bit about the body, but we don't know enough about the body to really help our community. And what we more importantly wanted, and you've done a great job because you meet with us, 2 times a month
Two
on
times a month.
Thursday? Yes.
Yes.
We didn't want just for our collaborative to know, but we also wanted the community to know. And the way you tell the story, we call it OBGYN 101 or
OB
something like that.
101.
OB 101. And what that means is that you're making complex information understandable to the common person. And why is that important? That's important because people are at the foundation of change. We spoke earlier today about change, right? And what has happened the last 40, 50 years is that a lot of these statistics that we're concerned about are the same, actually. They haven't changed much. And the reason they haven't changed is that we haven't really reached the people who can make them change. And so, what
Right.
you're going to be doing with that clinical piece, when you can tell us in such plain language, how our bodies work, how pregnancy happens, how you can actually prevent the kind of things that can make your pregnancy not be successful, then that is what we want. And that's what you're doing. That's how
Oh,
they
well,
come
thank you.
together.
Thank you. Yeah, I feel like when you're a clinician, you have more of a one on one. And we talked about this earlier as well,
Uh-huh.
one on one impact. But then how do you have a more global impact? So thank you for including me and the clinical
Uh-huh.
piece.
Thank you for being able to be included. And why do I say that? A lot of people can't really speak the language of people.
Hmm.
And you would think that physicians trained to do that because that's what you all do, right? But what we know a lot about now is people don't feel heard.
Sure. Oh,
And
yes.
people do speak to them, but people apparently are not, our clinicians are not hearing what we say. So you are special in the sense that you understand and yet you can speak our language. That's huge.
Oh, well, thank you. This is not supposed to be about me. This is supposed to be about introducing Dr. Bronner to the greater research community and the greater community. So, Dr. Bronner, we had talked quite a bit a few minutes ago about the power of the mentor. And sadly, we talked about our aging and needing to now mentor the future generation of researchers and clinicians. Can you tell us a little bit more like what you exactly were thinking about with the mentorship?
Hmm. Well, let me just begin with my own mentors. There were people like Dr. Cornley and Dr. David Page, and Dr. David Page was my dissertation advisor, but he also was the founder of WIC.
Oh my goodness.
So I had the Women's, Infants, and Children's Supplemental Program that most people in our project work with. Huge, multi-billion dollar program now. But back at that time
Wow.
when I was his student and we were out collecting data in the community, and this is why I really feel strongly about community, because it's what we learned in the community that allowed us to think big and to engage the government in a program that has such impact. And so that mentorship that I have gotten from them allowed me then to think, how can I pass this on? And so
Excellent.
down through the years, we were able to, be engaged in projects at both the local and national level. That national level allowed me to sort of have a network of folks. And I'd just like to mention Dr. Michael Warren, who's the head
Okay.
of the Maternal and Child Health Bureau, Laura Kavanaugh, who is now his replacement as he's moved on, and Carol Johnson. These are people that you come across your landscape and they leave their mark. And that's what I guess mentoring is all about, right?
Sure,
Uh,
sure.
they're coming from different perspectives, and at the time you meet them, you don't really know how this is going to have an impact. You mentioned the word impact, but in the long run, everything that happens to you lands somewhere. And so, what
Yes.
they've done over the years in my life, I'm feeling great to be able to mention their names.
That's so amazing. For
Mhm.
me, WIC always was a program that we sent our patients
Yeah.
to
Mhm.
when they couldn't afford things like formula and diapers.
Yeah.
But you were there from the very
Very
beginning.
beginning when we collected the data.
Great mentorship.
Uh huh.
So once we have established who we're going to mentor, how we're going to get the future excited about these things, how do you think that we should frame the research piece?
hmm Now, the word research was often, at least to me, a novelty. And when I was in training, I didn't even know what it meant.
Right.
But as I have been a researcher for 40 years, there's nothing mysterious about research. Everybody
How
should
so?
do research.
How so?
And the reason it is anytime you want to change what you're doing and make it better, that's research. And I often
Wow.
use the common, and maybe it's not the best example, but people who dig ditches, something as menial as that. They can dig the ditch one way on a given day, and they say, I think I can do if I did it this way, it might be better.
Okay.
And when they ask that question, if they systematically improve what they're doing, that's actually research. And what we should do is
Ah.
teach people to think that way. Because earlier in our conversation, you mentioned the single most important thing we want, and that is change, right? But the reason we don't get as much change as we want is because people think change comes from the top, but actually, change comes from the bottom, it comes from the people.
From the
Until
community and
people
the people.
realize their
Mhm.
power to change, if they think somebody's going to come in and change them, it's sort of like when I'm teaching. I say to the students, I actually only empower your learning.
Excellent.
I cannot teach you. If you don't allow what I'm saying to come in, it's not going anywhere, right? And so it is for the community. The community has to recognize that change comes from them. And if they don't change, we don't see change. And so everybody is a researcher. And in line with that, everybody can teach themselves.
Mhm.
That's the other thing. I'm not trying
Mhm.
to get rid of my job, but I tell my students it's not about me. It really is about you. You are your own best teacher, and everybody is a researcher.
Excellent. Thank you so much. Welcome back from a quick break. This is Moms, Minds, and Medicine Inside Maternal Research. And we're here with Dr. Yvonne Bronner talking about the Research Collaborative and the Coordinating Center. And you've already told us the difference, but I did want to know a little bit more about the collaborative, who they are, what type of research they're doing, and how that ties in to what I did as a clinician.
All right. Well, I'm so pleased that we have an opportunity to really share who they are and where they're located. I'm just going to read the list. We have them in alphabetical order.
Okay.
In Alabama, we have Tuskegee. In California, we have Loma Linda University. In Florida, we have Florida International. In Georgia, we have Morehouse School of Medicine.
All right.
Hawaii, we have the University of Hawaii. In Maryland, we have the good Morgan State University. Mississippi, we have Tougaloo, and Tougaloo is our only undergraduate only institution.
Okay.
And when you mention the word research, that's very important because Tougaloo does exceptional work, even though they only have an undergraduate program.
Excellent.
In New York, we have Mercy, and Mercy is one of our minority serving Hispanic institutions. Ohio State is a part of this group because they
Hmm.
have three partners. One is Howard University,
Hmm.
and then they have Albizu, who has a location in Puerto Rico, as
Oh,
well as a location in Florida. In Tennessee, they have 3 programs as well.
Okay.
Tennessee State is the bigger of the 3, and then we have 2 at Meharry. We
Excellent.
have the Meharry Medical College, and then we have the Meharry School of Applied Computational Science, and that's a
Mm,
very important institution looking at AI that we're going to talk about a little bit later.
yes.
And Texas, being a big state, they have 4 institutions.
Okay.
We start with Texas Southern, and then we have Texas A&M. We have Texas at Arlington and Texas at the Rio Grande.
Okay.
Now, an important thing about these universities is that they have collected themselves in terms of the work they do. So let's start with Loma Linda. It's the only one that's addressing an issue that's very important, but it is unique in the
What is
sense that it's
that?
looking at sickle cell.
Oh my goodness.
And you know that sickle cell is very
Sickle cell
important.
can cause all kinds of problems for the mothers and the children. Yes.
And we don't know much about that in pregnancy. So we
Correct.
really appreciate that. Then we have 3 of our institutions that focus on community outreach. And community outreach is so important because we have done it sort of in old models, but we're now using a new model by the National Academy of Medicine where it requires us as practitioners to learn more about the community. We often talk about landscape analysis, environmental scans, where we're
Sure.
learning more before we go out. And so that's why that's important. And then, fatherhood is very special to me.
Uh-huh.
And we have several of our institutions that are looking at fatherhood. And then mental health and maternal health, as you well know,
Oh my
has,
goodness.
has,
Yes.
has risen a lot. So the rest of our institutions are focused on the mental health aspects. So we feel that we have a set of issues or domains that are really going to be impactful. You mentioned the word impact earlier, that are going to be impactful toward change.
I love it. The geographic distribution, the distribution of the different types of research.
Mhm.
You're hitting all of the really important, really important points where the clinical community is concerned. So
Absolutely.
it's so exciting. So, what does the future look like? Let's pretend it's the end of the collaborative's work.
Uh-huh.
What is the future going to look like once we have done some of this work?
Mhm. Well, there are a few points I want to make. And the first one is that we began with the end in mind. And I think that was Stephen Covey who says that,
Yes, I
right?
think you're right.
And a very important point, and this is really important, is that over the years, a lot of research is done. And then when the research is finished after 5 years, X number of years, communities are left with the project being done. So what we started out with was sustainability. In other
Okay.
words, we don't want it to be ending.
Okay.
We want it to be
Honesty.
continuing.
Excellent.
And we want to be continuing because we're thinking about it now. And how do you continue? Continue because you do one good work, but you get money. Got to have money to
Sure.
continue. Yeah.
Sure.
So
Research money.
sustainability is a big part of the future. The second part of the future, Dr. Turner, has to do with the fact that I am aged.
And we both are.
Everybody can see that, right? However, I say to all of the practitioners in the group, I don't want anything old about this project. So we're looking to the
Wow.
future with AI. I'm already learning about AI.
Artificial intelligence, the
That's
wave of the
right. That's
future.
right. And we're actually using it. In fact, we're not going backwards in time, we're going forward. And we're not afraid of the fact that this is coming at us. And so the question on the table is how can we make it work for us?
Right.
And guess what we're thinking?
I'm not
You
sure.
know where everybody is as they're on their phones?
No, not in America.
Not in America. Well, so what we want to do is to develop an addictive app. Can I say that in public,
I
Dr.
think
Turner?
so.
Is
I
it
think
okay?
so. An
Okay.
app that people come back to.
That's right. However, this app, we want to have the outcome be positive behavior changes.
What? Wow. Imagine that.
All the things that you know that people need to do to be healthier, we want them to want to do these things. And we think AI has solved a lot of problems. Can it help us solve this problem?
Right. That would be groundbreaking if I would have had an app. Let's just pretend it's weight loss,
Uh-huh.
where you're motivated to look at it to help you on that journey.
Hmm.
That would have been so impactful in those clinical years.
Yeah.
How smart.
So this summer we're going to work on that. And then the third aspect of the future is that we're training early stage investigators. So I'm not going to be around forever, although I'm not homesick yet, right? But the young people that I work with, we want them to really have this new vision, the vision that power comes from the people, and that no matter how much we know, if we're not able to help other people know this, and I was told people don't care how much they don't care how much you know until they know how much you
Yeah.
care.
Hmm.
And so we want to use that as our mantra as we go forward. And we want our early stage investigators to truly be educated on the science, but we want them to have even more education on the community and then
Right.
even more education on communication
Right.
because this is how you get your messages out.
Exactly. Mentorship.
Mhm.
So important in this work.
And then the last part of our future is you.
Oh,
Because what this is the inaugural podcast, right? But
correct.
you have a lot in mind for the future, don't you? You have people and colleagues and subject matter that you want to help our communities become acquainted with. And so, what we want to do is for you to tell us now, what do you think about the future when you think about the podcast?
So the podcast is not only to introduce the audience to the research centers and collaborative and coordinating center, but it's also going to be about breaking down the areas of clinical medicine where we have the greatest need
Hmm.
into bite-size
Peace.
information for the public
Hmm.
and for other investigators that don't really understand the clinical medicine.
Hmm.
So, what are the big things right now that are impacting you? Touched on some of them. Mental health's a big one.
Hmm.
Hypertension, high blood pressure, which leads to sometimes preeclampsia. That's a big one that's driving these rates of maternal morbidity and mortality up.
Hmm.
Pre-existing diseases, in particular
Mm.
diabetes and the
Mm.
obesity epidemic. So we want to touch on many of these types of clinical things
Mhm.
um, to again make it easy to understand, fun,
Yeah.
and we're going to have all kinds of experts from the clinical realm and hopefully from the research realm as well.
Mhm. And what you told me as well, you're not just going to share information about these subjects, but you're going to have people hopefully show how they actually have overcome, especially in the area of hypertension. This is something that many people in our communities have lived with, their families have lived with it. They think it's just what we do. What you know is diet, physical activity, and many other things can impact this, right?
Sure. And, in the clinical world, sadly, there's not a lot of time to go over all the things that can prevent disease.
Hmm.
And we want to emphasize also that pregnancy is a great time to think about your general health. People are
Hmm.
motivated.
Highly motivated.
Pregnant people, they really do care about what's going on in their bodies. So
Hmm.
they are motivated to make change.
Hmm.
So we do have a possibility of impacting their not only their present but also their future,
That's the most
because
important.
pregnancy tells you a lot of times it's like a mirror into your
Mhm,
future,
mhm,
what you're going to get as you age, and some
mhm,
of those things are modifiable.
mhm.
And not only that, you teach the woman, she's going to teach the family, and
Yes.
we're coming right back to our community focus.
Absolutely. So you see that you are at the center of all that we want to do in our future.
I'm so humbled.
Thank you so
Thank
much.
you, and thank you to our audience for tuning in.